Medicare, a nationwide health insurance program for people aged 65 years of age and older, and certain disabled or blind persons, regardless of income, administered by the Centers for Medicare and Medicaid Services, known as the CMS. Local Social Security offices take applications and supply information about the program. MACRA, the Medicare Access and CHIP Reauthorization Act of 2015. Legislation enacted to establish quality payment programs as a new way to pay providers by giving incentives for high quality and high value care. MAC, Medicare Administrative Contractors, insurance carriers that receive and process claims from physicians and other suppliers of service for Medicare Part B, formerly referred to as fiscal intermediary, Medicare carrier, and fiscal agent, Medicare Part B carrier, or contractor. Medicare Advantage Plan. Private insurance companies who have been approved by Medicare to offer Medicare Part C coverage to patients eligible for Medicare benefits as an alternative to traditional Medicare. MBI, a Medicare Beneficiary Identifier. This is the 11-character beneficiary identifier used on Medicare insurance cards. Medicare Claims Processing Manual, Internet-Only Manual. The publication which provides Medicare's general billing requirements for various healthcare professionals and suppliers, as well as claims submission information. MIPA, Medicare Improvements for Patients and Providers Act, a multifaceted piece of legislation containing provisions and funding to states to help older adults, individuals with disabilities, and their caregivers for special assistance. It also requires CMS to implement quality incentives into the ESRD bundled payment system to promote high quality services to outpatient dialysis facilities treating patients with end-stage renal disease. Medi-Medi, or Medicare-Medicaid, refers to an individual who receives medical or disability benefits from both Medicare and Medicaid programs, sometimes referred to as a crossover. Medicare Part A, hospital benefits of a nationwide health insurance program for persons aged 65 years of age and older and certain disabled individuals regardless of income, administered by Centers for Medicare and Medicaid Services, or CMS. Local Social Security offices take applications and supply information about the program. Medicare Part B. This is medical insurance or a nationwide health insurance program for persons aged 65 years of age and older and certain disabled individuals, regardless of income, administered by the CMS. Again, local Social Security offices take applications and supply information about the program. Medicare Part C. Medicare Plus Choice Plans offer a number of healthcare options in addition to those available under Medicare Part A and Part B. Plans may include health maintenance organizations, or HMOs, fee-for-service plans, provider-sponsored organizations, and religious fraternal benefit societies, known as RFBSs, and Medicare medical savings accounts. Medicare Part D, a standalone prescription drug plan presented by insurance and other private companies that offer drug coverage that meets the standards established by Medicare. Other names for these plans are Part D private prescription drug plans, or PDPs, or Medicare Advantage prescription drug plans, known as MAPDs. MSP, Medicare Secondary Payer, the primary insurance plan of a Medicare beneficiary that must pay for any medical care or services first before Medicare is sent a claim. MSN, Medicare Summary Notice, a document received by the patient explaining the amount charged, Medicare approved, deductible, and coinsurance for medical services rendered. Medigap, a specialized supplemental insurance policy devised for the Medicare beneficiary that covers the deductible and copay amounts typically not covered under the main Medicare policy written by a non-governmental third-party payer, also known as Medifill. Merit-Based Incentive Payment System, or MIPS, a quality payment program established under MACRA that will determine Medicare payment adjustments to providers. NCD, National Coverage Determination, guidelines mandated by the CMS at the federal level, which all Medicare contractors must follow, that are developed to decide whether to cover a particular service in accordance with CMS's definition of what is medically necessary and to provide coverage information for medical services. National Health Insurance, a legally enforced system of health insurance that insures a country's population against the costs of health care. It is usually established by national legislation, but may be administered by the public sector, the private sector, or a combination of both. NPI, a National Provider Identifier, a lifetime number issued to healthcare organizations and providers and used to identify them on claim forms. Non-PAR, non-participating provider, a provider who does not have a signed agreement with Medicare and has an option about assignment. The physician may not accept assignment for all services or has the option of accepting assignment for some services and collecting from the patient for other services performed at the same time and place. Also, a provider who decides not to accept the determined allowable charge from an insurance plan as the full fee for care. Payment goes directly to the patient in this case, and the patient is usually responsible for paying the bill in full. NF, Nursing Facility, a specially qualified facility that has the staff and equipment to provide skilled nursing care and related services that are medically necessary to a patient's recovery, formerly known as a skilled nursing facility or SNF. Participating provider or PAR, a physician who contracts with a health maintenance organization or HMO or other insurance company to provide services. Also, a physician who has agreed to accept a plan's payments for services to subscribers. For example, some Blue plans. 80% of practicing American physicians are participating physicians. Also, a physician who agrees to accept payment from Medicare. 80% of approved charges plus payment from the patient. 20% of approved charges after the $100 deductible has been met. Also, one who accepts TRICARE assignment. Payment goes directly to the provider. The patient must still pay the cost share outpatient deductible and the cost of care not covered by TRICARE. Premium, the cost of insurance coverage paid annually, semi-annually, or monthly to keep the policy in force. In the Medicare program, the monthly fee that enrollees pay for Medicare Part B medical insurance. This fee is updated annually to reflect changes in program costs. Prepayment screen, also referred to as prepayment edits, which are put in place for insurance carriers to prevent payment for non-covered and incorrectly coded services, also used to target claims for review prior to payment. A PPS, Prospective Payment System, a method of payment for Medicare hospital insurance based on diagnosis-related groups, or DRGs, a fixed dollar amount for a principal diagnosis. QIO, Quality Improvement Organization, A program that replaces the peer review organization program and is designed to monitor and improve the usage and quality of care for Medicare beneficiaries. A RAC, Recovery Audit Contractor Initiative. Proposal of legislation that originally created a demonstration program that became permanently implemented when Congress enacted the Tax Relief and Health Care Act, TRHCA, of 2006. This extended the RAC program to all 50 states by 2010. Its goals are to identify Medicare underpayments and overpayments and recover overpayments using automated review and complex review. An automated review is done electronically without human review, and complex review is done using human review of the medical record. An RA, Remittance Advice, a document detailing services billed and describing payment determination issued to providers of the Medicare or Medicaid program, also known in some programs as an EOB, Explanation of Benefits. RBRVS, Resource-Based Relative Value Scale, a system that ranks physician services by units and provides a formula to determine a Medicare fee schedule. Respite care, a short-term hospice inpatient stay for a terminally ill patient to give temporary relief to the person who regularly assists with home care of a patient. SSI, Supplemental Security Income, a program of income support for low-income, aged, blind, and disabled persons established by Title 16 of the Social Security Act. VPS, Volume Performance Standard, the desired growth rate for spending on Medicare Part B physician services, set each year by Congress. Next, we have our key abbreviations for Chapter 6. ABN is an Advanced Beneficiary Notice of Non-Coverage. APM, Advanced Alternative Payment Model. CCI, Correct Coding Initiative. CMS, Centers for Medicare and Medicaid Services. DC is a Doctor of Chiropractic. DHHS is the Department of Health and Human Services. DME, Durable Medical Equipment. ERA, Electronic Remittance Advice. ESRD is End-Stage Renal Disease. And GPCIs are Geographic Practice Cost Indices. ICU is the Intensive Care Unit. LCDs, Local Coverage Determinations. LGHP, a Large Group Health Plan. An MA plan is a Medicare Advantage plan. A MAC, Medicare Administrative Contractor. MACRA, Medicare Access and Chip Reauthorization Act of 2015. MBI, Medicare Beneficiary Identifier. Medi-Medi is Medicare Medicaid. MIPA, Medicare Improvements for Patients and Providers. MIPS, Merit-Based Incentive Payment System. MG is Medigap. MMA, Medicare Prescription Drug Improvement and Modernization Act. MSA is a Medical Savings Account. MSN, a Medicare Summary Notice. MSP, a Medicare Secondary Payer. NCDs are National Coverage Determinations. NF is a nursing facility. A non-par physician or provider is a non-participating physician or provider. An NPI is a National Provider Identifier. And a par physician or provider is a participating physician or provider. PFFS plan, a private fee-for-service plan. PPS is prospective payment system. PSO, provider-sponsored organization. QIO, quality improvement organization. And RA is a remittance advice. RAC initiative, recovery audit contractor. RBRVS, a resource-based relative value scale. And SSI is supplemental security income.